All right, Daisy, you're Medic 1. You're being dispatched for a 72-year-old male patient who suffered a fall.
All right. Okay, so I am going to, first thing when I get on the scene, PPE, BSIC. And then, is the scene safe?
Scene is safe.
Okay. And then the mechanism of injury, is it that fall?
Yes.
Okay. And then number of patients is just this one?
Just the one.
Okay, perfect. And then I am gonna request ALS assistance.
Okay.
And I'm definitely going to consider his C-spine. I'm gonna have my partner manually stabilize his C-spine.
Okay, it is now being manually stabilized.
Okay, perfect. My general impression when I walk in, what do I see in the room?
Yeah, you find the elderly male patient at the bottom of a small staircase inside his home, maybe 3 or 4 stairs.
Okay.
He is laying on the ground. He acknowledges your presence. He does appear to be grimacing in pain.
Okay, so his eyes are open.
Correct.
Okay. Is he like following me with his eyes, or are they just open at me?
He's following.
Okay. Hi, sir. I'm going to ask you a few questions, okay?
Sure.
Okay. Do you know what year it is?
Oh, it's 2024.
Okay, and do you know who our president is?
Yeah, it's Biden.
Okay. Do you know what city you live in?
Yeah, I live in Meridian, Idaho.
Okay. And if I give you 2 pennies and I give you 1 more, how many would you have?
Oh, that's 3.
Okay. Perfect. So he is A&O times 4. Just in case, I am going to go over a GCS scale as well at this point. So with his eyes, they are spontaneous, and he is having an oriented conversation with me.
Okay.
Sir, can you touch my finger for me?
He reaches up and touches your finger.
Okay, perfect. Thank you. All right. Next, I'm going to check for any apparent life threats and the chief complaint of this situation.
Okay.
So head to toe, do I see anything that's apparent life threats for me?
No obvious life threats noted.
Okay. And then next, I'm going to check and make sure his airway is open and patent. I am going to assume that since he is responding, it is open. Do I hear any noises or anything?
Nope. Good, clear, open airway.
Okay. And then breathing, what is my rate, rhythm, and quality?
He's breathing regularly at a rate of 22. No increased work of breathing noted.
Okay. And then I will just give him a nasal cannula just in case he's having a little bit of trouble breathing, just to aid him a little bit.
Okay. What's your flow rate?
I'm going to set it at 4 liters per minute.
Okay.
Okay, and then next I'm going to go to his circulation. Can I get a rate, rhythm, quality on his pulse?
Sure. Pulse rate is 90, strong and regular.
And then how's the skin looking? Is it looking good all over, or is there any cool, pale, clammy, or anything going on?
Skin's all normal.
Okay. And then is there any obvious bleeding at the moment?
You see some bleeding on his right forearm that appears to be from a skin tear. Does not appear to be life-threatening or anything of the sort.
Okay. So I am going to take note of that. See if we can get a clean sterile gauze, get that covered up for the meantime.
You have a partner doing that right now.
Perfect, thank you. And then I'm just gonna get a full set of vitals now.
Okay.
So can we get a blood pressure on him?
Blood pressure is 172 over 96.
Okay, and is pulse the same?
Yes.
Okay, still 90 and strong. And then what is his respiration now?
Respirations are still at 22.
Okay, and then what's his SpO2 percentage?
SpO2 is 99%.
Perfect. And then just in case, I'm gonna get a glucose.
We're gonna say blood sugar is 168.
Okay. All right, so for this next part, I am going to expose his skin just to look for any kind of deformities or bleeding going on underneath the clothes.
Okay, it's gonna be exposed.
All right, patient is exposed. I'm gonna put this as a low priority patient at the moment, but we're gonna do a little bit of history before we transport him.
Okay.
So I'm gonna start with, do you have any allergies, sir?
No allergies.
Okay, and are you on any medications at the moment?
Yeah, I take a couple. I take metformin
Okay.
It's for my diabetes.
Okay.
I take, it's some weird long name, hydro something or other for high blood pressure.
Okay.
And I take a torvastatin.
Okay.
Because I got bad cholesterol.
All right.
And then, what's that? There's something else for my something for my stomach. Omeprazole, I think, is what it's called.
Omeprazole. Okay. And then, do you have any medical history we should know?
Well, just those things I told you already, I guess.
So you've got the high blood pressure, and you're taking omeprazole for your stomach issues, and you've got the cholesterol issues, and that's all you know of?
Well, I got I'm type 2 diabetes.
Type 2 diabetes, okay. Do you remember the last time you ate today?
Oh, yeah, I had breakfast about an hour ago.
Breakfast about an hour ago, okay. And then, what were you doing when you fell? Were you just heading down the stairs?
Yeah, I just kind of tripped over my own feet. My wife says I'm pretty clumsy, I guess.
Yeah, okay. And then, are you in any pain right now, sir?
Oh, my hip's killing me.
Your hip's killing you?
Oh,
okay.
It hurts.
I'm going to ask you a few questions just about that pain, see how it's feeling, okay?
Yeah, sure.
Okay. Did it just start hurting when you fell?
Yeah, I kind of landed on it, I think.
Okay. And then it's not hurting anywhere else, just that hip for you?
No, not really. Just, yeah, my hips just hurt me something fierce.
Okay, and is it like a sharp pain in that hip just from hitting it?
I don't even know how to describe it. It just hurts.
Okay, could you rate it on a scale of 1 to 10?
Oh, probably a 12.
A 12 out of 10?
Yeah, it's the worst thing I've ever felt.
Okay, so now I'm just going to check your body. We're going to get you in the back of the ambulance. I'm going to have my partners help me with this part. We're going to make sure we keep your spine in line for you. We're going to get a spine board, get you put on that on the gurney, and then into the ambulance with us so we can check you out all the way. Okay, sir?
Whatever you need to do, I trust you.
Okay, now that we're in the ambulance, I'm going to do the head-to-toe assessment as my secondary. So I'm going to be checking for the full decap BTLS. I'm going to start at the head.
Okay.
So we're going to get the full cranium in the back, make sure there's no lacerations or cuts or anything.
Okay.
Get the eyebrows, cheekbones, and nose, jawline. Make sure everything's all good. Next, I'm going to check his ears, make sure there's no cerebral spinal fluid coming out or any blood or anything. Do I see anything in there?
Nope. Everything you've checked so far, no abnormalities found.
Okay. Next, I'm going to check his neck, make sure that he has no JVD or any tracheal injuries. Make sure his breathing's still good.
Yep. No JVD, trachea's midline.
Okay, checking his C-spine on the back of his neck, making sure that's good.
That's all good.
Okay. Next, I'm going to move to his collarbones, make sure those are good, and shoulders.
Yep, that's all good.
And chest, palpating all over just to make sure there's no obvious deformities.
No deformities, no crepitus, anything. You're all good there.
Okay, I am going to listen just in case, listen for lung sounds.
Lung sounds are clear bilaterally.
Perfect. Okay, then I'm going to move down to the abdomen, palpate around there, make sure there's no distension.
Okay.
Or hardness or anything like that. Do I feel anything in his abdomen?
No abnormalities found.
All right, and then I'm going to warn you, sir. I do have to check your pelvis just to see what's hurting you there. Since you said that is what hurting. I'm going to try to be gentle, but I do have to look at it, okay?
That's fine.
All right. I'm going to move it up and then push down.
Okay, you feel some deformity to the right hip.
All right, I'm going to make a note of that.
Okay.
So deformity to right hip, anything else?
That's it.
Okay, 1 second. Okay, next I'm going to move to his lower extremities, checking his legs first. I'm checking for capillary refill and motor sensory. Can you feel that, sir?
Yeah, I feel that.
Okay.
Capillary refill's good.
Good. Okay, other leg, I'm gonna check that for you.
Okay, coming down, you do note that that leg is shorter than the left leg and appears to be externally rotated.
All right.
Okay.
I am gonna check cap refill and motor function still on this one as well.
Okay, CMS is intact.
Okay. So noted on that one. Okay, next I'm going to check his upper extremities, palpating for any deformities or anything on his arms.
Okay.
Cap refill on his arms.
Nothing abnormal.
Okay, and then can you feel it when I touch your fingers, sir?
Yes, I feel ya.
Okay, so there's nothing on his arms.
Okay.
Last part, with the additional help of my team members, we are going to roll him 1, 2, 3.
Good.
And we're going to check his back, starting at the base of the neck, all the way down the spine, feeling for any deformities. And then the back of the hip, this is where it is.
Yeah, that's where you notice that deformity.
Yeah, all right. Trying to be gentle. Sorry, sir. Setting you back down. All right, there's that deformity. So
Okay.
After that, we're going to reassess him, keep him on oxygen. Can I get another set of vitals here?
We'll say no change to the vital signs.
Okay, so since there's no change in the vital signs, I'm going to say he has a possible fracture to his femur. I mean, not his femur, his hip bones, noted with the external rotation and the shortening of that right leg. We're going to try our best to just keep him as comfortable as possible on this ride. I'm going to call into the hospital. St. Luke's, this is Medic 1.
Go ahead.
I have a 72-year-old male. He experienced a fall and has a possible fracture to his right hip bone. His vitals are, his blood pressure is 172/96, pulse is 90, respiration rate is 22, his SpO2 percentage is still 99%. He is on a nasal cannula with 4 liters a minute at the moment, and his glucose is 168. We're about 10 minutes out. Is there any questions?
No, we'll see you in 10 minutes.
Okay, thank you.
All right, cool. Okay, so you're all done.
Okay.
How do you think it went?
I think I missed something about that diabetes because I did get his blood glucose earlier and it was high,
Okay.
and he said he was a type 2 diabetic, but
Okay.
I didn't do anything about that.
What can we do is at the EMT level about high blood sugars?
I mean, we can't really do anything.
Right, so there's nothing to do. And secondly, he has a history of diabetes.
Yeah.
We need to find out what his normal is. 168 for him could be his normal every day.
Yeah.
And so is he hyperglycemic textbook? Yes, but compared to his normal,
It could be.
it could be pretty normal for him. So
Okay.
it depends on how well he takes care of himself. It's hard because, we have a simulation here.
Yeah.
Is he overweight? Those kind of things. So 168 could be pretty normal for him.
Okay.
Other than that, how do you think you did?
I think I probably could have done a little bit more. I probably should have splinted that, done something to keep
Okay.
it stabilized during the ride.
Yeah.
I did kind of skip over that, thinking back on it, because that hip, there is stuff that we can do to try and keep it stabilized, especially when we're moving him around, and I skipped over that.
Yeah, so we'll definitely want to splint a pelvic fracture.
Yeah.
But this doesn't lend anything to make me think it's a pelvic fracture.
Oh.
The shortening and external rotation typically is going to be what we call a hip fracture.
Okay.
And so it's actually more like a high femur fracture.
Okay.
So you have the head of the femur, right, the ball that comes into the
Epiphyses.
hip, the greater truncator. And so that ball gets broken off essentially.
Oh, okay.
So could we put a wraparound maybe for comfort measures? Sure, but we're not really worried about, with a pelvic fracture, we might have that open book pelvic fracture
Yeah.
that's going to bleed significantly. We want to make sure that doesn't shift. We're not really concerned about that here. So
Okay.
realistically, at least in my experience in the field, if we have an ALS provider, probably do some pain management for this patient.
Yeah.
And then gently move them, but there's not really much we can do there.
Okay.
But overall, I thought you did really well. You definitely passed. You did good on that. Going through a couple things, you never really asked a chief complaint right off the bat.
Okay.
And so that could have kind of given you an idea a little bit earlier that maybe he's got that hip pain.
Yeah.
So you got the mechanism, but you didn't ask about what's going on today, right?
Okay.
You asked about life threats, but didn't get that
Chief
he had the hip pain. You caught it later. Coming down, you did a nasal cannula. His respiratory rate was a little bit outside of the normal range,
Yeah.
which is just a pain response. You're totally appropriate to give him a nasal cannula for that purpose. Let's see. You got your GCS score. I like to see remembering to talk about major disability for the patient.
Okay.
Right, that's the D in the A, B, C, D, and E.
Yeah.
GCS score is part of it. It's just as simple as making sure that neurologically he's intact everywhere. Wiggle your toes. Can you feel me? Touch all your extremities, all of that, to make sure that that neurologically he's intact. That's what
Yeah.
we're looking for in the disability. Exposed, vital signs were all good. Your secondary was really good. You hit just about everything. You didn't check pupils. which
Yep.
is important, especially with a fall patient. We want to make
Yeah.
sure the pupils are pearl. Other than that, though, you were able to recognize what it meant that he had the the externally rotated shortened leg
Yeah.
with a deformity more towards the rear. So you're all good there. Reassessed everything you did. So yeah, you did a good job.
Thank
Nice
you.
work.
Thank you.